COVID numbers in Mississippi have made a major jump, and it's causing concern. 12 News' Deidre Briscoe spoke to doctors about the uptick in cases.
Over the weekend, COVID numbers escalated to nearly 2,000 cases. According to the Mississippi Department of Health, cases have been slowly rising since April. On May 31st, there were 576 cases and suddenly have nearly doubled.
So that one had a very high, it was very infectious, and it had a high death rate, and it was devastating. And we didn't think anything could be worse. And then, of course, Omicron came along and said, watch me. So Omicron was even more infectious, but it had a lower death rate. Of course, the problem with Omicron was the infectivity was so much greater than Delta that we had a massive surge of cases.
The doctor says we're still dealing with Omicron, but it is a variant version of it. He says the virus tends to cause a less severe version of COVID-19, but surges are to be expected. Now residents say it's the new reality.
I feel like we're expecting it to come and go, just like any viral type situation. It's going to have a life cycle where we see more and we see less. I think some of it's just going to be our new reality.
Doctors have this advice for those who are against getting the COVID-19 vaccine.
I don't plan to get into a car wreck. I always put on my seatbelt just in case. I don't expect my seatbelt to save me from all injury if I do get into a car wreck. I don't even expect it to guarantee that I'll survive the wreck if the wreck is bad enough. But I still wear my seatbelt. Why? Because I know it helps. It reduces my risk of bad things happening. And vaccines, like the COVID-19 vaccines that we have, do the same thing.
Doctors also say that the severity in infections range due to a person's individual makeup, whether it be previous illness, weight, or genetics. Reporting in Hattiesburg, Deidre Briscoe, 12 News.